Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Asana Cayetano.
And thank you for joining us this morning.
It feels like we're nearing the end of the month, right?
Yes, last week of January.
And soon enough we'll be sighing a breath of relief from the MAGA season. That is January.
Yeah, well, we'll see. I know it definitely still is a difficult time for many people. And so, you know, we were commenting this morning that the weather is so lovely. It feels almost like March, but you know, we're not going to get ahead of ourselves there. It's just a really nice morning for you to step outside.
I'm just grateful that the weekend we had beautiful weather, as you mentioned, and waking up this morning to sunlight and you know, the birds chirping and everything kind of warms up the mood going into the week.
That's right. So let's find out what our weather is going to be like for today. Our general situation is for mainly fair weather to prevail. The 24-hour?
The 24-hour forecast calls for mostly sunny skies today and partly cloudy tonight. Shower activity, if any, will be isolated.
All right. Our winds are moving from the east-southeast at 10 to 20 knots. And the sea state is choppy.
The outlook for Tuesday and Tuesday night is for fair weather to prevail with little or no rainfall.
All right, our highs for today are going to be 88 along the coast, 92 inland, 80 in the hills. And
the lows for tonight, 78 degrees along the coast, 72 degrees Fahrenheit inland, and 65 along the hills.
All right, and we want to thank our forecaster, Catherine Cumberbatch, for putting that together for today. So clearly, it's going to be a nice day today. Not too hot and windy.
Yeah, January weather.
So we're going to keep things moving this morning and get into a bit of motivation to get you started. So that means it's time for our Eye Opener. And our Eye Opener is taken from dailyom.com, and it goes like this. Fully experiencing our own hurt is the gateway to compassion toward other human beings. Every day we hear stories of personal suffering and loss that far exceed our own. When we compare our situations to those of people living in war-torn countries or those who have lost their homes and livelihoods to natural disasters, it is tempting to minimize our own experiences of suffering. Feelings of loss, abandonment, loneliness, and fear are universal. And in that sense, all feelings are created equal. Our personal lives provide us with the material we need to become fully conscious. If we reject our emotions because we think our experiences are not dramatic or important enough, we are missing out on our own humanity. We honor and value the human condition when we fully inhabit our bodies so we can experience and feel life fully. Accepting our emotions and allowing ourselves to feel them connects us to all human beings. Then, when we hear the stories of other people's suffering, our hearts can resonate with understanding and compassion for all of us.
I think this eye-opener this morning, I think in terms of dealing with your feelings, your emotions, experiencing them and being able to relate them to what other people are going through, I think it calls for a delicate balance. Why I'm saying that is because while it is good for one to experience his or her own feelings and accept everything that comes along with it, the feelings of joy, the feelings of hurt, disappointment, and all of those other feelings that come together. One has to be careful, in my opinion, not to necessarily put that on someone to where they get overwhelmed by only what you're going through, as opposed to you being able to share enough for that person to be able to understand and relate to what your experiences are. There are a number of times when you're sharing with someone, either in an intimate level, as people in a relationship, or a friend or someone you meet along the way, and that individual is going through something, and he or she chooses to share with you, but the manner in which they are sharing their feelings can be overwhelming. And if you were to receive that and open up to it, you're already like everything is coming at you so fast that that individual wouldn't be able to understand how you are responding to it. Because a lot of times, Marlene, there are certain things that make you feel the same way I feel. We might have different experiences, but it draws us back to that one particular feeling of loss or disappointment or euphoria if it's something that we're excited about, right? But we have to be able to step back and say, okay, Marlene, this is how I feel, and give you the opportunity to share how you feel based on information or based on experience that you've been through.
Yeah, I hear what you're saying. I think for me with the eye-opener, I think the concept of being able to acknowledge emotions is really what stands out to me. You know, and it really kind of just swings in one direction where I think the focus is. We don't usually have a hard time, you know, embracing emotions like happiness or joy, but if it's on the negative side, then we want to shy away from it. And I think for me, that's what the eye-opener hints at. That you have to be able to allow yourself to experience it. Because when you've had that experience and you're not just kind of dismissing it or putting it to the back of your head, putting on that facade that everything is okay or you're unbothered, if you don't go through that experience, it makes it so hard to connect with people when they're in maybe not the same space, but similar space. And I hear you on the point that sometimes we are not in a capacity to absorb or to empathize with someone else's emotions. And it takes, it's a very uncomfortable conversation to say, well, you know, I can't deal with that right now. But the fact that you're cognizant to know that that's where you are is really critical as well, because you know what the empathy entails. You know, we could be a lot kinder place, and we use the cliche all the time, you know, put yourself in someone else's shoes. It really goes to the core of what the eye-opener talks about. If you know and understand the emotions and the range of feelings that you have when somebody else is in that spot, you can understand. You won't feel their pain, but you can understand their pain especially. And it can make us so much more of a considerate community and lend to so much more understanding and kindness.
And the truth is, it's not everything that we'll be able to relate to. But being able to understand the circumstance and the experience and feelings that come along with that individual being in that particular place, so to speak, allows us to be more compassionate, as you're saying. People share how they're feeling quite a number of times to others who are willing to listen. But not because we're listening means that we've gone through that very same exact situation, but we could understand the feeling that comes along with that. And that's where the empathy comes in as well.
Absolutely. All right. So that is our eye-opener for today. We're going to keep things moving. Of course, it is time for us to do our check-in with the big news that's coming up this week, and of course some of the events from over the weekend. So let's shift gears to Eye on the News.
So where I want to start off with this conversation this morning is based on a video clip that is at this point in wide circulation of a visitor a tourist who was on the island of Caye Caulker, and it shows her being arrested by a police officer. And the woman is clearly in the video expressing that not only has she familiarized herself with the law that deals with the wearing of masks and what have you, but that she was simply having a meal. She was eating something when she was encountered by the officer. And the point that I want to make here is very clear. I think that from the onset, when we've been dealing with the mandate for the wearing of masks and what have you, we've always mentioned that there should be a measure of discretion that is exercised. Mm-hmm. If an individual, for instance, is leaving a store and has a bottle of water, for argument's sake, mm-hmm. and takes a sip of water briefly before putting his or her mask back on properly, and it so happens that an officer walks by, I think there should be some kind of discretion exercised in that particular point. If someone has a candy bar, for instance, you have to be able to say, you know what, let me clearly differentiate when the person is wantonly not using the mask properly or not wearing a mask at all, versus if it's something that is being done in that particular moment, yeah. Right? And so I think that's the basis of what we're seeing here. Beyond that, however, is the fact that it looks bad, because this is potentially something that once it gets out there, mm-hmm. can be something that deters visitors from either coming to Belize or going to Caye Caulker or any other destination for that matter, at a point in time where we're trying our best to be able to invite persons to come back into our country to help to recover the economic situation that we're facing, mm-hmm. as a result of the loss of tourism. Mm-hmm. So I think it's a unique issue that we're seeing here. I would want to think that those in the industry, either the BTIA or the BTB or whomsoever, would probably weigh in on what we've experienced here. And of course, I would want to think that perhaps the department would have something to say as well. Perhaps there is a perfectly fine explanation that they will come up with. I'm not certain, but I'm saying that we need to hear from all sides as to what transpired here. So that's the first place that I wanted to start off the conversation, Marlene.
Yeah. And in fact, the commissioner did make a post on mm-hmm. Facebook saying that the matter was brought to his attention and that the officers erred as the lady was in fact eating. Mm-hmm. And she kept on, showing her chicken wing to the video camera, and that she should not have been arrested, and she was mm-hmm. released. The video has been all over Facebook. I think the weekend people mm-hmm. have been watching it, and there's been a lot of comments about whether the officers were right or wrong, and what the long-term implications can be from something like this. Mm-hmm. I know I've read stories from some of the international outlets that outline people who have had interactions with police while on vacation because of COVID regulations in each mm-hmm. country. One of the things that you said, I think, was very clear. She said in the video, I read the laws, mm-hmm. I read the rules, and if I am eating, I don't need to be wearing a mask. So there are a lot of questions, I think, that come out of this. One, discretionary power is, mm-hmm. is critical. Mm-hmm. What is being told to officers about when that gray area exists as to how to respond? By no means are we saying treat tourists or international visitors any different from Belizeans. Mm-hmm. But I think that it also has to be underscored that officers across the country understand very clearly the details of the regulations, and that they're able to look at situations and assess them as to whether or not it is necessary for them to proceed with an arrest. So that's one of the things I think of. I can also say, and maybe this is something people didn't really haven't focused on. I actually thought the officers were respectful. And I mean that in a way as to how they interacted with the woman and also interacted with the person who was videographing. It's probably not the positive that we want to see at that time, but I did make that observation.
Which is a fair observation to make, indeed.
And so, you know, it didn't escalate into anything. But what is important is what's the damage control that comes from this. And also to hear from them directly why they chose to arrest this woman or charge or take her in to charge her for not wearing her mask properly. Was it that she was given a warning before? Was there something that happened before that we don't know about? So I think there are a lot of questions about the scenario itself and whether or not the BTB or the BTIA has intervened to ensure that she leaves with a more positive experience than what we have seen captured in this video.
So yeah, so that's the first point that we wanted to discuss this morning, because as you rightly said, this video has been in circulation for the better part of the weekend and it's the talk of the town, so to speak. So that's one. So the other one as well, since we're talking about COVID and all these other stuff, is the fact that the numbers are consistently going down, which is a good thing, but it's a matter of trying our best to keep it at a minimal. When you look at the fact that we've had over 11,000 confirmed cases since we began recording the individual instances of persons being confirmed positive for COVID-19, and you look at the fact that we are now at 389 active cases, and this is 10 months or so later. There's still work to be done, but you look at the numbers being constantly going down. Like I said, I think it's something worth noting. We spoke with the acting director of health services on Friday, where she clearly indicated that notwithstanding the numbers going down, the positivity rate continues to be something that is being closely monitored, because the chances of persons contracting and based on the number of tests being conducted, it's still worrisome. We're not totally in the clear as yet.
I think that's perhaps a headache that they have lingering all the time as health officials, because they're putting out the numbers so we are aware and we can keep track, but we cannot be fooled by the numbers for two reasons. One, there are many asymptomatic people out there all the time that won't be captured until someone starts to show symptoms or they've been informed that they have been exposed. So that's one thing. We can't just say there are only 389 cases definitively. Those are just the ones that we have identified at this time. But yes, I mean, we had this, I know you did a story on Friday looking at the positivity rate, which is still at almost, just a little under 20%, which is progress. A month ago, we were at 21 going on 22. So it is progress, and we're seeing less people testing positive. There's also a bit of fluctuation in the number of tests done on a daily basis. I know many people have noted that as well. But we are not in the clear, and I think that's just one of the things that we have to repeatedly say and think to ourselves as well as we continue to move around. The minute we've seen it before, things seem like they're getting to a better place, and then shortly after we see a spike. And you know, just speculating, I would think, because we all feel, oh, we have this under control, and we fall short on sanitizing, proper mask using, or interactions.
And it comes at a time, quite honestly, where stakeholders, for instance, are clamoring for some sort of a relaxation when it comes to the existing curfew. I mean, we've heard the complaints before. You're at a tourist destination and there are perhaps families who are staying at a resort or at a hotel and want to be able to be out and have a meal at nighttime or what have you, and the restrictions are such that they're not allowed to or not able to, and even if they can, they're in a rush to try to beat the deadline and what have you. And I think there has been some talk and perhaps some consideration at the higher level in terms of government to see what will come in the next few days or in the next week or so in respect of revising or revisiting the existing laws that concern curfew and the other measures that are in place.
Yeah.
So I think that is something that we will be looking forward to.
Well, we keep on being told February 1st, which means somewhere during this week we should hear about what changes may be coming as of the start of the month.
Yeah.
Start of next month.
Which is next Monday, a week from today. So that is the other thing that we're closely looking at. And now to shift gears quickly, we've also been discussing the upcoming municipal elections. Those are set for the 3rd of March, right? And for some reason or the other, things seem to be slowly coming around in terms of the slates being put out there, the announcements of candidates who will be running on the particular tickets and what have you. I know that this coming Sunday there will be a convention held by the People's United Party to determine who those councillor candidates will be. I know that the current mayor will be offering himself once again in that particular capacity as the mayoral candidate. And there are several other candidates that we know of who are not councillors as such, but they will be throwing their hats in the ring to contest a seat on that particular ticket. So that's what we'll be looking forward to this Sunday. There are 9 municipalities across Belize, and each of those 9 municipalities will be responsible for putting forward 2 slates or more. We know that we have 2 mass parties, so that's why I'm saying 2 in the first instance, but if the BPP or if there are independents, all of that will come to pass at some point where we understand fully how many candidates and what are the areas of focus for each of the 2 parties, or the 3 parties for that matter.
That's right. It's a slow start to this election season, but I imagine once we hit next week, which will be the 1-month marker before the actual day to go to the poll, we'll see and learn more about the official slates, because they've been very conscious, or it's been very difficult to get official confirmation as to who will be running. We know Belize City for the United Democratic Party, they have confirmed that, but the rest are still pending.
Now, to round off this particular conversation, on Friday, there was an announcement from the Elections and Boundaries Department that their offices across the country would have been opened over the weekend. So it was like a sliver for persons who wanted to register to participate in the upcoming elections. And I believe, if I'm not mistaken, that ends today. So if you're out there, if you're out there and you want to be able to register in your respective municipality to participate in the March 3rd elections, you can still do so before the end of day today to become eligible to cast your vote. So that rounds off our conversation this morning for the Eye on the News. Remember that these stories and more will be our focus at 6 o'clock. You can catch us on News 5 Live, or you can also catch us on Facebook, where we live stream our content as well.
That's right. And we are back, and we are getting ready to move into our conversation for today. And we are continuing with our COVID-19 update. Today we get to hear from a physician that is working in Houston. He's a Belizean, but he is now working at the Houston Methodist Hospital, and he works in the ICU center. So we have Dr. Stephen Su, who's going to be sharing his perspective there in Texas, and also putting some perspective on the situation of COVID as well.
And our second conversation, since it is Motivation Mondays, we'll be discussing how to get and stay motivated on your own. Self-motivation. That's going to be our second conversation this morning.
All right. And we're going to go ahead and take a break. But before we do, we got a birthday shout out. And we are saying happy birthday to
Aisha Williams. There she is. Happy birthday, Aisha.
Have a fantastic day, and that comes from all of us here at Channel 5 and Open Your Eyes. We'll take that break now, and when we come back, we'll have your COVID-19 update for today.
It's a fact that you can access unlimited services with Smart. Tired of being measured or cut off when you need to be connected? It's a fact that when you sign up for Smart's Plus plan, you get unlimited talk, text, and unlimited data. And it's a fact that you can sign up with your group of up to 5 members for Smart's Share plans and up to 40 members for Smart's Enterprise plans for unlimited talk, text, and data. Smart has the true unlimited plans. That's a fact. Be smart and live smart.
Everyone is at risk of catching COVID-19, so it's important to quickly recognize signs and symptoms of the infection. The most common symptoms are fever, dry cough, and tiredness or fatigue. Some people may also have sore throat, aches and pains, stuffy nose, or diarrhea. But a few people have also reported pink eye or conjunctivitis, headache, loss of taste or smell, a rash on skin, or change in the color of fingers or toes. Emergency warning signs that require immediate medical attention are extreme difficulty breathing, severe constant pain or pressure in the chest, becoming confused, unable to talk or move, bluish lips, face, fingers, or toes. For more information, call 0800 MOHCARE. Help keep Belize safe.
And we'll be back in a few, so stay tuned. Thanks, Jen. Hey there, we know you have to head out to work shortly, but don't forget that you can stay tuned by watching us on our Facebook live stream. Find us at Open Your Eyes BC, and you can continue watching there. You can also download Facebook Watch on your streaming device, and you can watch at your own convenience.
And for all the behind-the-scenes fun, follow us on Instagram at OYE Belize. So,
find us
and follow us
today.
When someone you love becomes a memory, the memory becomes a treasure. Channel 5 introduces the Daily Obituaries. The Daily Obituaries will broadcast all death and funeral announcements and memorials to honor your loved one's life and memories. The Daily Obituaries airs on Channel 5 prior to the evening newscast, with subsequent repeats at 10 p.m. and 12 noon the following day. It will also be placed online on our social media platforms, all for a standard package fee. Celebrate their lives and memories with Channel 5's Daily Obituaries. Honor in life and reverence in death.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
And welcome back. We are about to get into our first conversation of the morning, and we have with us online via Zoom Dr. Steven Su. He is in Texas, but the conversation this morning is pretty much relative to Belize and all other parts of the world, which has to do with COVID-19. Good morning, Dr. Su.
Good morning, Isani. Good morning, Marlene. How are you doing?
Man, we are great. We are great. Let's begin, first of all, by getting your professional overview of the COVID-19 situation, both in the United States where you are, and perhaps your observation of what is happening here in Belize in terms of our present state of affairs.
Yes, well, thank you. And so let me start out by saying that we have been dealing with this for almost a year. Yeah. And this past week marked the 1 year since the first case that has been discovered in the United States. At the beginning, we really start out by having the whole system start activating, but it's kind of a rush back in March. We didn't have enough testing, the PPE was in question, and we have very sick people to begin with. And at that time, I think Belize was doing a very good job back then to have the high alert as a system and a country, so that you did not feel that first wave hit. I think as a whole world, we were more vigilant back then, as opposed to be here in the United States. Folks were initially observing and adhere to the guidelines. However, that kind of falls short within a month or two due to economic, political reasons. And so we were suffering quite a bit. And at the very beginning, although people might have not seen those waves, but we are in the ICU. I'm at the ICU here at Texas Medical Center, which is the largest in the world. And I have seen a full COVID ICU since March. And until this very day, we are still going through all the waves. And we're in the thick of the third waves right now, which has been a bit quite detrimental in terms of mental morale for all the healthcare staffers here in the United States. And what I'm in Belize as well, and also unfortunately, we also seen the waves that has come by due to sort of the lax in terms of the adherence to the guidelines as well. And this is not uncommon. In the U.S., we have seen recently a study of over 7,000 folks across the United States that at the beginning, the adherence rate was about 70%. And going into about November or so, most people have fallen down to 50, 60%. And you only take a few to really spread the virus itself. And also we have come to learn that the virus spreading are mostly coming from a lot of asymptomatics or mild asymptomatic individual that accounts more than 50, 60%. And so through family gathering, although everybody wear a mask, and however, when you go home, when you go eat, the mask is down. Those are the times that when we start to see the spikes through family gathering and events as such. And so that's still, we will be going through this for probably upcoming months, if not the entire year. I don't want to be pessimistic, but at the same time, cautious. Even though I got my vaccine shots already, both of them, but at the same time, I feel that the community as a whole, unfortunately, we will have to reach that 60 to 80% vaccine herd immunity to attain that.
Let me ask you a quick question. You've mentioned that you've taken both of your vaccines, but when we look at what's happening perhaps in the United States or other parts of the world, there are persons who are naturally fearful of being given a vaccine shot, notwithstanding the fact that we are faced with a very serious pandemic where perhaps being vaccinated is the way to go to prevent having to deal with this crisis situation going forward. What do you believe is perhaps one of the reasons, or maybe the main reason why people in the United States are objecting to being vaccinated?
I think it's a personal, religious, but also informations. A lot of people offer and amplify the informations as such that they think the few cases of severe reaction applies to everybody. But in fact, that's not true. Currently, we've seen over 40 million doses has been given, and severe reaction is probably less than a dozen. So in that setting, for example, in my hospital, we have delivered over 65,000 doses already. Or 65,000 people have received the doses, and we only have a few cases of allergic reactions, but none has has required really to be hospitalized for severe allergic reactions. And because of that, we were very comfortable, and all of my staff are vaccinated, and everybody's back at work already. So I think it's information, it's education, and this is not new. This has been going on since previous pandemics, since even regular vaccines that we see in kids, adults, and so forth, that has been compromising a lot. But ultimately, it comes down to that it's a small percentage. It's really down to the regulations. For example, like flu vaccine that we have to get every season, it comes down to as a mandate by your jobs. So really, when it becomes as such, then it becomes normalized practice that everybody gets to have, and it takes the fear away for the most part.
Dr. Su, tell us a bit about the work that you have been doing there. I know at the start of January, the biggest concern, and it was in many states, but especially in Texas as well, was that you would reach your capacity or beyond your capacity for hospitalizations. You work directly in the ICU. And tell us about what it has been like being on the ground.
Yes, so if I may, I will want to share a video which has been done by New York Times that was stationed within our ICU for about a month. Hopefully you can see this first. Yeah.
Can't happen to me.
So this is a lady that has been hospitalized who was who did not believe in the
Karina, can you get some leaves?
So she was going about and doing her own business. However, she contracted the virus, and here is what our staff really all geared up in helping her. She was intubated. She requires to be going through these what we call prone positioning. That's why she was wrapped like a burrito.
Believe it?
And then her anesthesia to let her sleep on her belly. Luckily, she survived to tell the story. The tube came out. She was able to go into
none of us are invincible.
So these are just a glimpse of patients,
I
and for her to come and tell her story that this is real. And next, I actually have some slides I want to share just to kind of recap what we were going through. So this is sort of back in March, end of March, within a few weeks when our ICU opens up, that the United States break #1 in the world. And that continues to, unfortunately, now we're occupying about a quarter of all the cases in the world. Meanwhile, Belize as a whole saw this, I believe is 1 in 30, close to 1 in 30 in the populations. So a little bit less than the United States, but I think as a whole, we're all approaching a scary numbers. And here is some of the picture in our ICUs. We had to convert a lot of our ICU rooms to negative pressures, and we're using a lot of resources. As you can see on the right-hand side, this is what we call ECMO machines, where my colleagues are doing cleaning of a patient's lung. Luckily, this patient survived, but it's the amount of resources that has to go in to really take care of these patients. And here's an example of what an ICU, most people don't have a chance to see this, so you see glimpse on TV, but these are the machines that we really pull outside to, so we could reduce our PPE use. But this guy, for example, required ventilator, dialysis, multiple medications and drips, and also very expensive nitrogen gas to help open up the lungs. And despite of all this, his heart stops, and we have to use automated CPR machines and shock devices to simply keep him alive. And what we have seen is about 1 in 5 hospitalized patient ends up in the ICU. And the mortality overall is about a third. Despite of all these resources, we're talking about 35% or so. And for those who's intubated, about 51% did not make it. And as age goes up, this number goes up, which is quite distraught for us.
Those are some really startling numbers. I know when we think of the resources that you have available there, naturally for us here at home, we're saying, do we even have access to all of the technology and also to the resources, both physical and human? Dr. Su, I know, and I wanted to get this in early. You worked here in Belize before you went off to specialize. You were at the KHMH, so you're very well acquainted. And I know your colleagues here keep in touch with you as well. So you're very well acquainted with the situation on the ground. As you started to see the pandemic unfolding in Houston, in your hospital, and you saw the severity of the illness and the amount of treatment required for hospitalized patients, what were your thoughts of Belize at that time?
One thing, I immediately, the Ministry of Health reached out, and we have set up meetings and sort of educational sessions for our staff right away, So all the health professionals and medical officers across the country were able to have a conversation and understand what's on the ground and share sort of my experience here on the ground here in Houston. And understanding that the resource has been quite limited, and I really have to give applause to the ministry and all the hospital system to really come together with the limited resource to put what we have in place in terms of treatment management and the plan that's devised. Even at one point, I felt the PPE in Belize is better than what I have in Houston. With the amount of things that were taken into account to take care of the sickest patients, it's really hard. And I think there's really no easy way out. Even here, we have to put all the resources together, pull extra people, hire extra people with the traveling nurses and doctors to really just help out, even as big as a system that we have. So I really have to applaud that my colleagues in Belize now is pulling this through. And for example, Dr. Pedro Arriaga at KHMH and Jorge Hidalgo at BHPL. So we're in constant conversation, and really I felt that the number in Belize is not that far off in terms of the rate, the mortality, and so forth, even compared to the United States. So it often brings me the question as to the things that we're doing here, are we making patients better? So it's a difficult conversation to have. Yes.
Let me go in a slightly different direction here, just to get your personal take as well. You are a frontline worker. You are exposed to people who are afflicted with COVID-19 on a daily basis. What has been your personal view in terms of the work that you are doing and seeing these persons who are coming in sick and having to deal with them, knowing that you yourself are putting your life on the line, so to speak?
Yes, it has been very scary because at the very beginning, I remember the first patient that we have, as I was going into the hospital, I felt I'm walking into a war zone, knowing that I have to wear PPE, wear N95 mask, and that puts an extra layer of mental stress. Mm-hmm. And as we churning through this and knowing how sick these people are and that they cannot see their family could not come in to see them. And even for me and my family, I always constantly worried that I would give this to my family as well. That added a lot of mental anguish to not just the physical threat that we have. Mm-hmm. Luckily, so far, we're all doing okay. So which means that the PPE and the practice that we have, going home, I set out a dirty zone in the garage, and then to protect my family from that, I sanitize and spray everything down, for example, and those seem to work. Mm-hmm. But this takes a big toll, and there are studies now looking, not just from China, from across the world, that more than half of healthcare workers do come down with some degree of PTSD or fatigue, and also just pandemic fatigue in general. So I think this will take a lot of time after the pandemic to really come to realize how much and how deep we're affected by it.
Pandemic fatigue. I think that's one that we all feel. Mm-hmm. And it's interesting when you speak of it from a physician's perspective. It's been, for some countries, I know for the US, for example, over a year, we didn't get our first case until March, so we didn't start facing restrictions and lockdowns till then. But we have all been talking about COVID-19 since this time last year. What happens is when we have this fatigue is that we let our guard down. The hypervigilance of talking about how long to wash your hands, how often to wash your hands, how snug your mask should be. Those conversations have long passed. What do you think is in this year too? Are some of the ways that we can kind of keep that sense of urgency for protection? We don't have access to the vaccine as yet. It will come, but just not right now. So what are your thoughts on that?
I think it has to be at multiple level preparation. So at the higher level ups who have a plan, as you can see how the vaccine has been rolled out in the United States. It sounds good, but it kind of fumbles and mumbles through compared with, for example, Israel or UAE, where now they have almost 40%, like, or approaching 40% of population been vaccinated, and they seem, and the effect is very tremendous. They're seeing about 60% drop in their cases so far. So that is a bigger planning ahead of the year. Once you have a vaccine, you want to deploy, you want to get that in people's arm. And as a country, for the general public, is to stay vigilant, navigate ways to go around, but meanwhile still maintaining these adherence to avoid contracting the disease, as we know that it's mutating, and it will only happen more if we allow more cases to occur. And so this is one of those where, unfortunately, you only realize how bad it is when it hits you or your family. So I think having the ability to see what's going on inside the hospital does provide some insights. That's why I felt what our hospital is trying to do is to share that information. But of course, often at times, it also becomes quite difficult because folks have not been able to, even if they see it, but they always feels like it's a very distant story. So I think, reiterations and also reassurance to the public, that's one thing. And of course, legally to kind of put this together will be quite difficult because there are economic challenges and so forth. So really have to come as a country to have a common goal. Where we are seeing in the United States, it's pretty fragmented, and we're seeing a lot of folks running around and behave as as this is not real. And it now come to think, if you would sit in a very packed restaurant or airplane, it looks like a scene out of a horror movie. And even so, that's why it's so hard. And me being on the front line, knowing this, it's even worse. So I think it's just have to come together to realize how to navigate and form our own new lifestyle, because this will not go away anytime soon. And they could always become seasonal. It could come back. It could become part of the flu, similar to the flu pandemic in terms of the way it comes in waves and so forth. So I think that would be sort of a general directions, unfortunately vague, but we all have to navigate it together.
Yeah. And when you talk about the patients that you've seen, because the information has been so widespread talking about the high-risk populations, the elderly, the obese, the people with conditions like diabetes, hypertension, or those who have a suppressed immune system. It oftentimes kind of separates society, and we think, well, I don't fit any of that criteria, so I'm okay. But the data clearly shows that people, even who are young, healthy, and who you thought were less predisposed, actually get severe symptoms as well and end up in the hospital. Do you want to share that experience as well?
Yeah, so this is very interesting because back in March, when we have our first wave of critical ill patients coming in, we immediately went from 2, 4, and with the packed 24 beds, ultimately 60 beds in the first wave, and now we're doing the same thing in the third wave. And when it was happening, we were only learning the data from China about these comorbidities. But then when it comes to Texas and now across the world, we start to realize a lot of young folks who's obese and who has a lot of comorbidities as well. But they're generally, especially also racial predilection. So in Houston, for example, we have about 40% Hispanic populations, but disproportionately our patients that's affected by are at least 60% Hispanics. So when we saw that, it was sort of alarming as to why. And until this day, it's still quite blurred as to why this is happening, but at the same time, a lot of cultural practices, multi-generational family, and sort of a lack of adherence to guidelines and so forth. So when we start seeing these young folks and obese folks that they thought they're impervious to it, that's affected by it, we immediately want to reach out to the community and let them know in terms of the practices. But unfortunately, that trend is still ongoing. The young folks now, what I'm seeing from first wave to third wave is that the young folks end up less in the ICUs, but a lot of their loved ones, their parents or their grandparents end up in the ICUs. And it's disheartening to say because we would, for example, have a couple in the ICU who's intubated, who cannot make decisions for themselves, and we have to call their family. And very often their family actually are in another hospital rooms, suffering on their own and making decisions for their parents, or they're recovering from it, or they're dealing with another death in the family. Yeah. And you realize that one question I always like to ask them is, how did you get it? At the beginning, everybody would tell me they travel, they got it from work. And then the third wave, some of them becomes a bit shy about why. And I feel a lot of it becomes a guilt. They feel like, oh, I went out to eat and I went to visit my parents. And it becomes a guilt. It becomes a mental anguish to them because they feel they're the one that's been spreading. And it didn't hit them until it really happens. So I think that's sort of the changes and waves and shifts that we were seeing. Not just how sick someone who is, but how the dynamic have changed in terms of the patient characteristics.
Yeah.
When you look at the fact that, for instance, as you're describing the third wave, people feel the need to cluster as families because you still have it in the back of your mind. I need to go and see my mom or my dad or my brother or some relative. I think part of the issue is at the moment is that we've gotten to a point where we're exhausted of having to remain at home or in isolation or having to abide by certain guidelines, and we're just seeking that freedom, even if it's just a little bit, to be able to go back to perhaps how things were before the pandemic. Do you feel like that is part of the issue why we're seeing that third wave and the characteristics of it as you described?
Very much so. As you realize, November throughout the winter time, there are multiple events happening, especially around where I live, in terms of the political wave change, in terms of family gathering, and then there's back-to-back Thanksgiving, Christmas, very close to each other. So, and you start to see travels becomes very lax. The airlines start to fly more. Yeah. And so, again, coming back to the pandemic fatigue, it kind of just really obliterated the scare and the fear, because a lot of it, when you come down and folks would feel like, oh, I'm so sick and tired of this. So let me just go ahead and go back because I don't feel anything. But unfortunately, when that happens, it doesn't hit everybody. Most people do fine, but then you have small clusters and it just continues and the clock keeps getting reset. And so it becomes, as a community, most people do okay. As I mentioned, 50 to 70% do adhere to the guideline, but then you have 30 to 40% that does not. So then the pandemic keeps going on. And I often joke and half joke that, when it comes to religious belief, that our belief really got put to test. How obedient can you be? How disciplined can you be? And each time you only need a small gap or small lack, and it'll hit you really hard. And unfortunately, that's what we're seeing. And that's why it's important to have a bigger plan in terms of herd immunity, in terms of vaccination to come and achieve, so that sooner than later, we could all move on and leave this behind.
Yeah. All right, well, what we're going to do right now is take a quick pause in the conversation. We do have more to discuss, of course, looking at what we know now about treatment and the importance of testing. So we're going to tackle those topics in just a few. We'll take a quick commercial break and we'll be back shortly.
Technology is ubiquitous, and it's transforming how, when, and where we work. Fulltech Systems is placing award-winning devices in the hands of information workers, allowing them to work without compromise in a world without wires, to innovate, create, and to maximize productivity anytime, anywhere, satisfying the needs of the desk-centric remote and field worker and every other worker in between. We are providing the industry's best devices to businesses going through the process of digital transformation. Partner with us today to provide the solutions that will allow your employees to work effectively and efficiently to enhance your customers' experience. Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
Caused intense flooding overnight in the western and southern parts of the country.
Yeah?
Do we need to renew the insurance policy?
The
insurance policy?
Highway were impassable.
Oh, let me check.
Renew your policies, file a claim, and even send us a message using RFNG Online.
Now we're good. It says we're covered.
Okay, great.
It pays to get it right with RFNG Insurance, a Road Group company.
If we are only as strong as our families, businesses, institutions, and the communities that surround us, then by giving businesses the power to grow, entrepreneurs the ability to expand, and by giving our families the right to own something, the Belize Bank gives you the power to build a nation, our nation. We are stronger together. The Belize Bank, our country, your bank.
We're back, and if you're just joining us, we are continuing with our COVID-19 update for today. We're joined by ICU physician at Houston Methodist Hospital, Dr. Stephen Su, and we've been talking about his experience in Houston in treating patients with COVID-19 for the past year. And now we're going to shift and talk a bit about the disease itself and some of the things that we have learned. Dr. Su, when you first started getting patients in the ICU, it was a new disease, and so learning to treat it has been something that I think we've all been hearing the experiences as we go along. From what we knew in January 2020 to what we know now, what has been the biggest lesson or information that we've learned about COVID-19 that has impacted treatment and the survival rate?
Yes, so I think one of the biggest lessons that we have learned is to stay calm. The reason I said that is at the very beginning we get so much information and disinformation that's competing each other, which we call it infodemics, not just pandemic but infodemics. And because of all these information, we really don't know what to do. So back in March last year, we at the beginning we were scrambling. We really are scrambling. We were using all the medication that you could hear. You hear about the anti-HIV medications, the hydroxychloroquine, and we're using it all at once. And I'm looking back at the patients we have back then. They have received everything. Until now, those have been disbanded or disproved. Whereby more evidence are accumulating throughout the years and throughout the whole year, and we realize that none of it works, and not the way we wanted it. But one of the important key things that we have gotten out of this is that how rapidly improving the biomedical technologies in terms of the way a lot of drugs are producing. We went from using those medications, hydroxychloroquine and so forth, to now using something called monoclonal antibodies. These are purified forms of medication that goes targeted against the virus from binding into the cells. So it's not like the regular drugs that you could find a compound and just make it in the mass production. These has to grow in a lab, and it takes time. And even at the current capacity in the United States, could only produce about 500,000 doses a year. So that's one aspect where I think has still slowly come to form. Yeah. And second is the plasma. And as we have heard, unfortunately, our beloved colleagues in Belize, Dr. Guerra brothers, during their critical states, that there was a call for plasma from recovered patients. So back in March, we started the program along with Mayo Clinic, and we actually delivered the first plasma in the United States. And what we have found is that these things work similarly to the antibodies, which we are counted the antibody that's made by the recovered patients. And we realized that it has to be a very, very high concentration for it to work. And it has to be given very, very early since the symptom onset, rather than when they're sick in the ICU. So the gear has started to shift it, moving towards to treat patients much earlier, even at outpatients. Instead of waiting home and getting Tylenol when you start to have symptoms like fever, shortness of breath, or cough, or even needing just a little oxygen, that is the time to be aggressive to treat. And it's similar to what we've seen, like influenza, for example. You have to take the Tamiflu within 48 hours. So the same idea applies to COVID. The earlier you do it, the better the outcome is, especially those who is in between. So 80% of COVID patients do recover without interventions, and there are 10 to 15 that becomes moderate to severe. And those are the group that we want to target so they don't become critically ill. And what we have seen is that for all these studies, and especially like remdesivir that you heard about, the antivirals, those stays, but it helps those who was moderate to become mild, but the severe ones are there to stay. We still see that 5% or so of the people becoming critically ill. So early intervention is the key, and of course the larger picture is to prevent it from happening.
And even the difference between when it was first thought to just be a respiratory illness to now the list of symptoms has expanded to so many other types of illnesses.
Yes, so it's actually more of a systemic disease, and it started out in the lungs, but then the viral replication phase happened within the first week. And so I always take this like flood. So when the flood comes and hits your house, that's when you want to block the water from coming in. So that's when the virus are attacking and replicating. But once the virus dies down, it's the aftermath, the broken down, the mold, the infestations, where the house started to crumble. There's no more water, but then there is other problems, and it kind of happens in the bodies too. So you start to see, for example, I call COVID brain, where it could be a viral component, but it's also a metabolic component. These patients are very, very difficult to sedate, very, very difficult to wake up. And we have seen a slew of manifestations such as seizure, stroke, bleeding in the brain as a consequence of this. And about a quarter of our patients develop kidney failures that require dialysis. And we have seen a lot of skin manifestations, neuromuscular weakness, gastrointestinal bleeding, and so just a slew of complications. And one big part is the infection, secondary infection. So one of the treatments that we are using a lot more is steroids, and which is a pretty cheap alternative, and it's pretty effective. But at the same time, it suppresses your immune system when you receive it for a long time. So we start to see a lot of secondary bacteria, fungus infections, and so that's when the house broke down, and you have mold, you have other things that grows, and that continue to ravage the body.
Yeah, we slowly are beginning to hear stories of people who have what they call long COVID, with the effects that linger for so long after. Let's shift focus now, though, and talk about, I know you have, you said very early on that the medical community in Belize reached out to you immediately because they knew you were working in Houston. And you've been providing training and education to the medical community here. Let's talk about the strategy that Belize has employed so far and your thoughts on it.
I have to say that I have to applaud the country as a whole to really put together the resources that we have to make it happen. And I think as much as folks might want to think that is not enough, which I think we really, in terms of the strategy that the government have put in place, the curfew, the semi-lockdowns that we've seen, it really has trying to achieve what it does and limited the spread. So on the community as a whole, I know there are people who's not going to adhere to this, but the enforcements that we're seeing, for example, to the extreme where the mask event that you guys were talking about earlier, it also goes to show how serious that our public and our officials have taken this into account. And Belize really have very little reserve to be compromised, especially with a wider spread. Second is that for at the community level, we're a little bit fortunate in the sense that, as I mentioned, more than 80% of the people do recover fine. So it has not, it is overloading to the system, but the system currently is holding on to it. And the resources, and again, as I mentioned, the PPE that I'm seeing my colleagues that's wearing probably is more than what I have in Houston. It's also reassuring that many are protected. We do see, of course, healthcare providers are being infected by it as well. And it really comes down to, not just what you get from work, but also at home, especially when you have a community spread as such that half of the chance is coming from home and not just from work. So it really boggles down to how we adhere in these guidelines. So I feel Belize has done a great job in reinforcing the guidelines so far. As much as we wanted to see it work, it just takes time and patience. And really, I think our folks has done probably a better job than many here in the United States.
Yeah. What are some of the recommendations that you make to enhance our system? I mean, one of the things that we know is that we are not sure whether or not we have the new variants of the COVID-19 as yet. We've sent some samples off to Baylor and CARFA, but we haven't gotten the results as yet. Many people in the medical community say, well, it's not if, it's when. Put that into perspective with some recommendations.
So with the new variants, it's what we call selective pressure. So when you have so many cases, it's bound to change. And it's putting in what I call the Serengeti rules of life. What happens at the virus level happens at the community level. So imagine you're trying to oppress a group of folks and they will evolve and change. So same thing with the virus. Yeah. So one of the things that it will find its way, it's life. It will find its way to adapt. It finds its way to be better at what it does, which is to spread the infections. And so for humans, we know it comes from contact, from air, from droplets, from aerosols, and all this. So the prevention guidelines will stay the same. And this is what I recognize as the hierarchy of control. When we talking about PPE and treatments, that's the least effective in targeting the virus. And we have to move one step up to really talk about eliminations. And this is really to prevent and eliminate, no matter what variant it is. And it's really, if you stop at the level of spreading, it doesn't go further. So, and it limits its chance of becoming more resistant and developing new strains. Yeah. So it really is a true test to humanity, as it is. How much can we stand to it? So bottom line is, keep those guidelines and follow those guidelines. And it really takes patience. And hopefully in the next 6 to 9 months, and as Belize have the ability to deliver the vaccine, later in the year, that the community as a whole to also educated about the vaccine, to be prepared of what's coming and to be ready to give it and to be ready to receive it.
And you spoke earlier of the convalescent plasma from recovered patients. So this is something that you said needs to be administered very early. Have you communicated with the ICU specialists here about the use of the plasma and how it's been going? I know that blood donations are usually difficult in Belize in general.
Yes. So at the very beginning, I did try to have the primary investigator with the plasma to reach out to our folks in Belize. However, the technicality in terms of the donation, not just that, but the testing. So you will have to test the plasma itself to ensure the titer or the concentration of the antibody has to be sufficient and high enough to work. So unfortunately, that even at the very beginning, we did not have the ability to test that until recent. So that has to be in Belize. If the lab has that ability to do it, then it makes it more efficient and available. But if you don't have that ability to do so, then very often we end up finding is we're giving these plasma, but they have either no antibodies or they have very low antibodies. And also the patient who already exposed to COVID previously, so we also seen a wave of patient who has antibody develop in the bodies. These plasma would not work. So right now, one of the contraindications to give the plasma is someone who has antibody already. Yeah. So it really comes down to the ability for the laboratory to test both ends for this to really become an option. And even then, go ahead.
I was going to ask if you know when there is the highest concentration of antibodies in the system. Is it immediately after recovery, a month later, 2 months later?
So it varies. It depends on the exposure. So we noticed that only a small fraction of the recovered patient carries the high titers and high concentrations, and it kind of started to go away as time goes by. We're talking about maybe the height usually is about 1 to 2 weeks. So our programs recommend the donation happens when you recover from the virus in about 2 weeks' time. And as time goes by, that number starts to go down. So there is a time from the donations, also for the time to receive by the patients as well.
Yeah. Now, as you face the second capacity situation at your hospital, you know, the U.S. is in their third wave. We are starting to see what was a spike start to calm down a bit. And we are cautiously optimistic. But what's been the recommendation that you've made to handle the healthcare and the treatment when a hospital or the hospital care reaches capacity? We have limited resources, and I know one of the things that the health professionals have consistently talked about is you can't just look at beds, you have to look at the people who are available to man those beds as well.
So it was or has been a growing frustration for us. For example, in Texas Medical Centers, we treated close to 50,000 patients since the pandemic. And the ICU beds are about 1,500 total. And that's a lot of beds, but there's a lot of normal sick patients other than COVID. So at the peak of it, more than half of it was occupied by COVID. However, the public was learning that we have the capacity to expand. You could turn the whole hospital into COVID, but do you have the ability to take care of these sick patients? And from experience, we have learned that it's not the same. You have a regular floor nurse who might not be able to take care of the ICUs. So although there is a bed, there is no people to man it. So it looks good on the paper, but it's not good on the ground. And that's why we had to hire traveling nurses. We had to hire traveling doctors that goes around the country really to different pockets of epicenter. And once they stay for a couple months until it dies down. And you end up losing a lot of money because of that. So one of the things, Go ahead.
How effective has that been in terms of introducing the idea of traveling doctors and nurses?
It surely provides some relief to the system. It allows the hospitals to still operate at a certain level. So one of the approach that you could see difference in the countries, for example, China, they have dedicated entire hospital to COVID or entire section to COVID, but we don't have that luxury because we still have to take care of the regular patients with cancer, with heart diseases, for example. Those do not stop. So we have to make sure that our nurses and doctors don't get diverted away from those areas. So when the capacity allows, we use those extra manpower to really go and help in those areas. Meanwhile, trying to still maintain some degree of normal operations. And so it did provide the short relief. However, from a personal level, it becomes more challenging because you don't know who you're dealing with. The staff might not be familiar with the system, so it creates a lot of learning curve and chaos at the very beginning for us as well.
Now, I'm sure, as I said earlier, you keep in touch with your colleagues here, and having worked within the hospitals, what you've seen that we've been able to create with the COVID-19 unit in getting people. I know we report on the deaths, but there's so many people who actually get released from ICU care as well, and having been successfully treated for COVID. What are your thoughts when you know what they have been able to do with the resources that you know exist?
I'm very proud. I'm very proud of what we're able to achieve in Belize with the limited beds that we have. As I was in contact with Dr. Arriaga, for example, yesterday to learn about the numbers that they have and the mortality. I'm actually very I'm awed to know that the number is not very far off from what we are seeing here in the United States. So I think, folks on the ground really put their heart and soul into working and make sure that it works. And so that's the same mentality that I have, and I have taken away as a medical officer from Carl Huchner, working at the A&E back then. And so I felt that spirit has stayed, and it really carries on as a whole. It's more than just a job or career, but it's a mission to safeguard the country, to make sure that it works. So I think Belize has really adapted and has really taken on a difficult task during the pandemic to make it happen. So I think I have to really applaud to my colleagues in Belize to make it work.
Yeah. And as we start to see people clamoring for loosening of restrictions and being able to have a bit more freedom, what are some of the things that you would hope we'd consider?
It's scary because we don't know when that can come about. The normalcy, that's something I pray for 2021, is to return to some sense of normalcy, but we're still far from that. So, but when they start to return, I think we have to be cautiously optimistic, as you mentioned, to open up slowly, because we've seen that happen the last time when we open up and then the cases rises. So it really comes down to, we have to see what's going on around the world, especially Belize rely heavily on tourism and for folks and imports to come in. Then really it's until all the cases around the world are subsiding, and when the immunity and so on has achieved, then really opening the border, really opening up back to normalcy is more safeguarded. Yeah. But while we're entering that phase, we have to still take the same precautions, which we know is working. We know the mask, we know the physical distance, the hand hygiene. And if you're sick, please avoid visiting. And those measures stays, and it will stay until really we reach that goal together.
All right. Well, Dr. Su, we do appreciate you sharing your experience with us this morning. And talking a bit about what you have seen there and your thoughts on what's happening here in Belize.
Thank you, Marlene. Thank you, Zani. It's a pleasure.
Okay, and stay safe.
You too.
Okay. And that's it for us with our COVID-19 update for today. We're going to take a break, and when we come back, we're going to be talking about how to stay motivated. And so that's coming up in a few. Please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Es un hecho que puedes obtener servicios ilimitados con Smart. ¿Cansado de que se corte la línea cuando más necesitas estar conectado? Es un hecho que cuando te suscribes al plan de Smart Plus, obtienes llamadas, textos y datos ilimitados. Y también es un hecho que te puedes suscribir con un grupo de 5 miembros al plan Smart Share y hasta 40 miembros al plan Smart Enterprise para llamadas, textos y datos ilimitados. Smart tiene los verdaderos planes ilimitados. Es un hecho. Sé Smart y vive de forma Smart.
Todos estamos en riesgo de contraer la COVID-19, por lo que es importante reconocer rápidamente los signos y síntomas de la infección. Los síntomas más comunes son fiebre, tos seca y cansancio o fatiga. Algunas personas también pueden tener dolor de garganta, dolores y molestias, congestión nasal o diarrea. Pero algunas personas también han reportado conjuntivitis, dolor de cabeza, pérdida de sabor u olor, sarpullido en la piel o un cambio en el color de los dedos de las manos o los pies. Los signos de alarma de emergencia que requieren atención médica inmediata son dificultad extrema para respirar, dolor constante y severo o presión en el pecho, confusión, dificultad para hablar o moverse, labios, rostro, dedos de las manos o de los pies azulados. Para mayor información, llame al 0800-664-2273. Protejamos nuestra salud.
Keeping safe from COVID-19 at your workplace requires 100% teamwork. You can keep earning while keeping yourself and others safe by doing some basic things. Wear a face mask at all times in the workplace unless you are alone in your own private space or office. Wash your hands frequently or utilize alcohol-based hand sanitizers and avoid touching your face. Disinfect surfaces like doorknobs, tables, desks, and handrails regularly. Increase ventilation by opening windows or adjusting air conditioning. Limit visitors and deliveries to the workplace and use appointments where possible. Attend meetings virtually as much as possible, and when not possible, hold meetings in open, well-ventilated spaces or rooms that allow for everyone to be 6 feet apart. Stay at home if you or a family member at home are feeling sick, or if you have been in contact with someone who tested positive for COVID-19. Keeping the workplace safe also requires that employees act responsibly when away from work. Practice social distancing and good hand-washing hygiene. Avoid large gatherings and avoid unnecessary exposure to others. Protecting others means protecting yourself. Together, we can defeat COVID.
In partnership with the British High Commission.
And we'll be back in a few, so stay tuned. Thanks, Jen. Hey there, we know you have to head out to work shortly, but don't forget that you can stay tuned by watching us on our Facebook live stream. Find us at Open Your Eyes BC, and you can continue watching there. You can also download Facebook Watch on your streaming device, and you can watch at your own convenience.
And for all the behind-the-scenes fun, follow us on Instagram at OYE Belize. So,
find us
and follow us
today.
When someone you love becomes a memory, the memory becomes a treasure. Channel 5 introduces the Daily Obituaries. The Daily Obituaries will broadcast all death and funeral announcements and memorials to honor your loved one's life and memories. The Daily Obituaries airs on Channel 5 prior to the evening newscast, with subsequent repeats at 10 p.m. and 12 noon the following day. It will also be placed online on our social media platforms, all for a standard package fee. Celebrate their lives and memories with Channel 5's daily obituaries. Honor in life and reverence in death.
And welcome back. We are embarking upon our second and final conversation for the morning. And this conversation has to do with how to get and stay motivated on your own. That being said, we have with us Charlotte Neal Lopez. She is the Managing Director of Belize Institute for Service Excellence, Leadership and Research, BISLR. Good morning, Charlotte.
Hi, good morning, Isani. Good morning, Marlene. And may I say Happy New Year's as well to you guys.
Same to you.
Thank you.
All right, so it is Motivation Monday, and we're trying to find the best way how we can remain self-motivated. There are a lot of us out there who need that little impetus, or we need that push from someone else around us. But in the absence of having persons who are there for us, how can we be able to do so on our own?
Awesome, thank you. So 2 weeks ago, this is our third week, we embarked on a free webinar, and it's called Motivation Mondays. And for the past 3 Mondays, we've been engaging members of the Belizean public for free on how to get motivated and how to stay motivated. Now, as I shared when I was on one of your shows, maybe last year, that our vision is for inspired people who are serving with passion and excellence. And we believe that if people can just be inspired, motivated, that if they can find that passion, that through that they will excel and Mondays will not be a drag. We like to say that we have two types of people, those who love Mondays and those who don't. And those who don't love Mondays are those who are not so motivated. And so I know that a lot of focus is on setting goals and having vision, and we want that. We encourage you to do that. You need that. But unless you have that intrinsic motivation, you are not going to meet those goals. That vision will feel like a far off pipe dream. So how do you dig deep inside to find that motivation, that intrinsic motivation that we so often lack? And we wanted to make this information available because I realized that in my quest to find more meaning in life, that it was a huge search. It was not something that was readily available. It took me years to get to where I felt that I was finally living out my purpose. And so we want to be able to help others to come to that place even quicker. All right? So what do we do? And how do you start finding that motivation? And we believe that it is in finding your purpose, that your passion is in your purpose. And whenever we start talking about finding your purpose, people feel like it's wow, that's huge, that's big, we don't talk that kind of language. And for a long time I felt that finding your purpose was, well, what do I have to do? Go off to the mountain? Yes, right? Until I discovered through, really searching and researching and listening to some of my powerful key motivational speakers, that your purpose really is in your passion. And so we start off by looking at what it is that you like to do, what it is that brings you that joy, what it is that motivates you. And it is in that you find your passion. I go back to maybe one of my second job, and I was a secretary. And I enjoyed being a secretary. And I was like, I like this. And later, when I was able to look at my passion and my purpose, I realized I don't like being a secretary. What I like is dealing with people. I like interacting and engaging with people. And so that provided me the opportunity to do that. And it's something I am still passionate about. So what is it that you're passionate about? What it is that you enjoy doing with the least amount of effort? And it's a question that all of us should be asking ourselves. I can guarantee you, Marlene, you've been doing this for years. And I bet you if you were not passionate about it, you would have been long gone and been replaced by somebody else. Am I right or am I right?
I would take back my sleep any day, but I do enjoy it. That's why.
Exactly right. And so maybe for you, it's interacting. Everybody has. Now, the trouble with finding our purpose and why we dismiss it is that we think it has to be a big calling. Right. We have to be saving the world, or we have to be the CEO, or we have to be some, it's whatever you love doing. Yeah. That is where your passion will emerge. If it's baking cakes, if it's, cutting hair.
Let me ask you a question here, because it's interesting that you started this at the beginning of the year, and I'm sure you've gotten a lot more insight into kind of where we are in our mindset here culturally, in how we see what our motivators are. I know when you read books on this or you hear different articles, there are different schools of thoughts, and one of them is that people have different value systems, and so some people place more value on the contribution of the work that they do. Some are looking for maybe the titles and prestige that come with it. Some like to know that they're helping to build a community, to educate, to assist in some way. Some are looking for earning money and being able to advance their life based on that. How do you factor these things in? Because I see that as a real sense in what really pushes people to work harder.
I totally agree with you. John Maxwell talks about survival. Yeah. He talks about the other level, which is success. And then he talks about significance. Yeah. And for me, I found that so interesting because at that survival stage, you don't find a lot of fulfillment. You're going through the routines and you're doing it because you have to do it. You need to pay the bills. Yeah. But I believe that you can still find significance at that survival stage. For me, significance is about how you are able to contribute and impact the lives of others, those around you. And that does not have to be anything grand. Significance can also be that you are living out your dreams, you're living out your purpose. And so there is significance on that. When we place our success, when we rate our success on the material things, when we measure it against what we are able to accomplish materialistically or position-wise, it's fleeting and it does not bring you much lasting value or pleasure or passion even. I find that even when you accomplish all of this, sometimes you feel empty if you're not doing it for a purpose, if there's no passion behind it. So it really comes to nothing, in my opinion, that significance is really the goal for all of us. And we can do that in our own small way.
There you have the question.
Wherever we are planted. Sorry?
I said, there you have the question. What values give my life the greatest meaning?
Yes, right? It's important that all of us find that. One of the things I find in our culture as well is that we don't often ask ourselves the question, how badly do I want this thing? Because that is what's going to help push you in the direction that you want to go. How badly do you want it? What is it that you're willing to do to get this thing that you want? And sometimes we're not hungry enough. Les Brown says you got to be hungry. And we're not hungry enough. We get discouraged easily. We give up because for us it's like complacent. But if you are passionate, it's the passion that's going to fuel. It's the passion that's going to keep you up late at night, early in the morning. It's a passion that's going to drive you forward. Steve Jobs said to, find what you love. Yeah. Do what you love, and you will never work another day in your life. And I laugh when I hear the quote. I understand what he's saying. But the truth is, you will work harder than you ever worked on that thing you love. But it's a labor of love, and that's why it does not feel like work. Yeah. It does not feel like work. You keep going because in your mind, you're excited. You're all lit up. So I'm not telling people, quit your day job, because some people are like, Ms. Neal, that's all good for
Life
you.
Is
I have
real.
to work.
Yeah.
I have bills to pay. So nobody's saying quit your job. That's a reality for many. But I advise two things. Find something that is as closest as possible to the thing you enjoy, or along with your day job. Don't lose sight of what you are passionate about. And every opportunity you are given, or you create those opportunities to do those things that you will keep you alive, right? Be relentless in the pursuit of the things that set your soul on fire. That is how you really feel alive. I see people drag themselves to work daily. It's like, oh, I'm here again, another day. Is it just 2 o'clock? And I too went through that routine for a period of time, but I found that while I was doing things that paid the bills, I also could pursue things that I was passionate about, and I could develop those skills, and eventually I could move into that role completely. So it's possible. It's very possible.
So it's also very realistic, and I think it's necessary for us to acknowledge that sometimes, even with a clearly identified purpose, we lose motivation along the way. And it's a really difficult time right now. Things may be, maybe you lost a loved one, maybe you lost a job, maybe you lost some income, maybe you're just struggling with everything going on. And we lose our motivation too sometimes. How do you kickstart that engine inside of you to get the fire going? What are some of your recommendations? Because it's oftentimes a bit, I think, depressing for people when they think that, oh, I'm not motivated anymore, and people may make it sound too easy.
Most definitely. Remember, what you lose is your motivation. You don't lose your purpose. Your purpose is that it's within you. It's what you do. It's what you love. And so sometimes losing your motivation simply means that you need to take a break. Rest if you must. Just don't quit. It requires, to me, sometimes I lose my motivation and I go back and I get engaged. I get engaged with things that's going to help me back on that path. Sometimes it's picking up something that has nothing to do with the purpose, the goal, my job. It's picking up something like exercising or taking a break and going off somewhere. And while I'm there, I find my balance, and I find that maybe I was just too overwhelmed. There were too many thoughts flooding my mind that I did not see a clear path. What I needed was to seek clarity. And so I come back, or I talk to people. I listen to stories, and then I remember, this is why I'm doing what I'm doing. This is why I'm doing it. And without this, I feel like I am lost. This is my calling. So while you lose your motivation, you don't lose your purpose. And you get back on again, and it's okay. It's okay. But that fuel is out there if you look for it. One of the things I also recommend is talk to people. Talk to people who know you well, and you will find that they are amazed at the things that how well you do what you do. It's like, girl, you can't stop cook. I mean, your cooking is the best. You make the bomb chicken. It's like, how can you? It's like, really? Yes, you can't. And you see, that helps, right? When
Yeah.
people tell you, no, I need what you do. The world needs what you do.
That's
So
a
it's
form
what
of
you tell
positive
yourself and what
reinforcement.
others tell you. Yes, yes?
No, I'm saying it's also a form of positive reinforcement.
It is. You know, one of the things, like I said, it's like getting that mentality that says you can't quit. And you go back and you look at your success, because sometimes we overlook our successes, you know. We don't realize how far we've come. So sometimes getting that motivation requires going back, and then you say, wow, you know, I was doing so and so, and look what I'm doing now. I'm doing better. And sometimes it's not about the money, it's about the impact. Because motivating yourself also requires looking at the impact you're making. And so when people are able to give you that positive feedback and to say, you know, I heard your story and it changed my life. That's exactly what I was going through. That's where I was. And so I encourage people to tell their stories as well. I tell others, you know, tell your story. Let people know it's difficult. The road is hard, but it's possible. It's possible if you keep going and keep going. It's not a bed of roses, but that thing within you, it's not going to leave you. You're going to feel frustrated unless you continue on that path to finding your purpose and your passion.
I love the share your story part. I think that many times you may see what you personally consider as a success in another person, and you perhaps only see the good from it, but you don't know all the work that came along with it. All the
Most
challenges,
definitely.
all the failures, all the no's, all the tough nights, all the rebounding that may come from it. And
that is a fact.
Yeah.
And you know, Marlene, and this week we're talking about authenticity. And I believe we need more authentic people, more authentic leaders who are willing to share their story, own their story, and say, this is where I came from. This is what it's about. And you too can do this. But we often, like you see, we see the finished product. We don't see the labor, the cry, the tears, the things people had to give up, the losses along the way. We look at the end products. We forget that along the way, these people were planting seeds, and it's the fruits of that labor that is now coming to bear. And so I encourage people to tell their stories.
But how do you do that in the social media world, where all people want to see is the highlight reel of your life?
Yeah, there's this famous author, speaker that I love that speaks about vulnerability. She's
Brené Brown.
Brené Brown.
Yeah.
And she's awesome because she looks at the fact that authenticity is not, and sharing your story is not going telling everybody, and you know, you pick your audiences, you pick what you want to say. You don't go tell your stories to complete strangers. There is a way to do it in such a way. And social media, you are so right.
Yeah.
If it's not that, if you share a joke, you're going to get thousands of likes.
Yeah.
Share a deep, touching story, and a few people will comment. But that speaks to the fact that we are not used to that vulnerability, that authenticity. It's a clear indication, because to be vulnerable also requires that you hone that skill of empathy, that you are able to put yourself in the person's shoe. Instead of turning your head and pretending it doesn't exist, you actually stop and say, that must be tough. So empathy is one of those qualities that goes along with vulnerability and authenticity. They go hand in hand. And we as a society, we're not used to that. We're not used to that.
The concept seems foreign to
It
us.
makes us feel uncomfortable because it reminds us too much of our stories, if we're honest. And we don't want to go there. We don't want to go there. But we should go there. We should go there.
So what's been the experience talking about motivation with a group of Belizeans online?
It's been awesome. People can relate, and I try to make it as practical as possible.
Yeah.
I try to give practical things that can be done, including, if you notice, we have a life purpose questionnaire that people can take their time and go through the questionnaire, ask themselves some of the difficult questions. For me, it's more stirring up the conversation, making this information available and letting people know it's possible. It's very possible, but you have to want it. You have to want it so bad that you're willing to do whatever it takes to get it. It starts with you. I can read 1,000,000 books and watch 100 videos and attend 2,000 courses. But if I'm not internalizing this information, because the motivation needs to be intrinsic. So that's a help, but it's here. It's really here. My final thing that I encourage people to do in our courses is to get a mentor. And your mentor needs not be somebody that is physically that you can meet with, but it's somebody you emulate. That's where you want to go. That's your standards. That's the thing that powers you up. Maybe their stories are similar to yours. If you can get a mentor that you can meet with and interact with, that's going to be awesome. But if not, then just find those that you look up to. For me, in my earlier days, it was Oprah. I was crazy about Oprah. I was like, Oprah. I wrote Oprah's letters. I sent her emails. She didn't answer any, of course. I wanted to be, my dream was like, I need to be on the Oprah show. But see, I'm doing something better now. I am on Open Your Eyes with Marlene.
There you go.
But it was, and so that was my, my thing is like, find, and that's standard. And so it does help in terms of where you want to go. Who is your model? Who are you looking up to? Can we find it? It's possible that you can look up to that, find out their story. It's going to help. It's really going to help along the way.
When you mentioned earlier about the fact that we must be honest and know that some people are looking at just basic survival. But even in that space, you can create some of your drivers, some of your motivations as well. And I can't help but think of people that I know are struggling either with insufficient work or no work, and they're still the most pleasant people you can interact with. They're honest about what they're going through. They're not pretending that everything is honky-dory, but they're still positive because they know an interaction or the interaction that they have is also important. And it for me, it's the first example that came to mind when you spoke of still, even in survival mode, we can still be purpose-driven.
You can be. You see, there's that hope that your passion and your purpose springs in you. And one of the things is to ensure you don't give up hope. Where there's hope, there's life. Even the Bible tells us that. And so it's hope. It's getting up every day. Sometimes I get up and I say, something good is going to happen today. I don't know what that thing is, but it's going to happen today. And nothing happened today. I say, okay, tomorrow. It's going to happen tomorrow, but every day I get up, I'm expectant. I'm planting seeds. I continue to push. I don't give up. Even when money isn't coming in, funds aren't, what you would want them to be. You keep pushing and you say, it's going to happen. Yeah. I can't give up, because if I give up, if I have nothing and I give up now, I'm still going to have nothing.
You have less.
But if I keep pushing, chances are 2 weeks or a month from now, I'm going to have something, even maybe not what I want.
Yeah.
But giving up really means that you defeat yourself even before you enter the starting gate. One of the things that we also look at is overcoming that fear of rejection. Why a lot of us, we don't put ourselves out there. We don't put ourselves because we are afraid of rejection. And it's a real phenomena. When we study it, studies have shown that when it comes to rejection, that the same part of your brain that is engaged, that reacts when you are feeling physical pain, that's the same part that responds to rejection. It's real. It's real.
Yeah.
It's not perceived. Yeah. And I said, wow. but understanding that there is a way to overcome that fear, and it's on that other side of fear that you are going to find success. And to every no you receive, it builds you up. If you don't take it personal, if you say, okay.
If you learn from it.
You learn from it. You learn from it. You don't sit down and say, oh, I wasn't good enough, or, you know, they don't. You keep going. You keep going and you say, okay, I didn't get this one. Now what do I have to do? Maybe I have to brush up on my resume. Maybe I have to change my pitch. But I'm going back in. And you go back in and you don't quit until you win. And then you celebrate those small wins.
Well, I feel like we just had our Motivation Monday just now in this session. I don't know about you, Isani.
No, I'm here soaking it all in because it's real what she's saying.
It's so refreshing to hear, and no matter if you feel like you're a self-driven person or you're not, it's so good to hear that we are all ideally looking towards the same direction. It's just kind of staying on that path. Charlotte, how do people get engaged in your Motivation Mondays? I think you said it's a free session.
It's a free session. Today is the last live lecture, and you can send me a text at 670-9564 just because it's this late for you to register. But if you text me 670, send me a little WhatsApp 670-9564, I will send you the Zoom link. But if you're not available for our live sessions, that's fine. You can still go to our online learning platform at www.bzlearn.com and get enrolled, because we upload the live lectures and a wealth of really great information for you as well on the site. So you still can tap into it after the fact. We would love to have you.
All right. Well, thank you for giving us our Motivation Monday for today, and also for offering it to the wider community as well. I'm sure you guys have had a number of productive sessions, and people can now be motivated to check out all the other online courses that you have available as well.
Yes, we have a calendar from January until July, and we encourage you to go to our website again, bzlearn.com, and find out more about our courses, as well as each month we offer a free course, a free mini course. Next month we have time management. So there's a lot going on. We have courses specific for teachers. We have courses for public officers and public sector employees. There's a lot going on at bzlearn.com. We also have a Facebook page, Belize Institute for Service Excellence, and we encourage you to just go on and get engaged.
All right.
Our motto is engage, inspire, equip. You will leave with something. You will leave with something.
All right. Thank you so much, Charlotte.
Thank you.
Thank you so much too, Marlene. And I'd like to leave you guys with a quote on courage from Theodore Roosevelt, and a reminder, especially regarding that question you asked me about Facebook posts and the way people respond. And he talks about it's not the critic that counts, and not the man who points out how the strong man stumble, or where the doer of deeds could have done better. The credit belongs to the man in the arena. Get in the arena. That's the word I want to leave with you today.
That's one of my favorites there too. It's on my wall. Have a great day, and thank you so much.
It's my pleasure as always. Have a good day, everybody. Goodbye, Belize.
And you know, we're just gonna wrap that part up. I feel like we've gotten a lot of motivation there, and we will be back in a few to wrap up our show.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
It's a fact that you can access unlimited services with Smart. Tired of being measured or cut off when you need to be connected? It's a fact that when you sign up for Smart's Plus plan, you get unlimited talk, text, and unlimited data. And it's a fact that you can sign up with your group of up to 5 members for Smart's Share plans and up to 40 members for Smart's Enterprise plans for unlimited talk, text, and data. Smart has the true unlimited plans. That's a fact. Be smart and live smart.
And we're back.
Still feel like I have a sugar rush from that motivational Monday conversation. I think I want to start the wrap up there. Simply to say and to remind folks that motivation is found within first and foremost, right? If you need any form of impetus to get out and do, it has to come from within yourself. You have to see it, want it, and make all effort to get out there and get it.
Absolutely. Thank you to Charlotte for sharing that. I think that's just what we needed to pump us up for the day. And it followed what was also a really great conversation with Dr. Stephen Su. Dr. Stephen Su studied in Belize. He started working at the KHMH. Now he is working in Houston as an ICU specialist. And he has been working along with counterparts here in Belize for a while. He, does training and converses with the people who are working here. It was really great to get his perspective as to what they're experiencing in the United States, specifically in his hospital in Houston, and kind of putting it into perspective for us that it is not over yet, and we still have to maintain all the vigilance that we started with a year ago and continue to do so to keep ourselves and our loved ones safe.
Yeah.
So we want to thank him for joining us this morning and adding to the conversation. And again, once again, thanks to Charlotte. If you want to join her Motivation Monday, today is the last day for that free session. It's at 10 o'clock, so there is time. Get in touch. Find her on Facebook or find her Facebook page and contact her and join in. It really is going to help you get started this week and be as productive as possible. But that's all the time we have for today. Remember, if you want to contact us, send us an email at oye@channel5belize.com. You can also drop me a line at marlene_oye@channel5belize.com. Find us on Facebook at Open Your Eyes BZ and on Instagram at OYEBelize. And remember to tune in tomorrow morning at 6:30 when you open your eyes
To start your morning right.
Until then, keep your eyes, your mind,
And your hearts open.
We'll see you soon. Enjoy your day, Belize.
Open Your Eyes was brought to you by the Belize Bank, our country, your bank.